Serotonin related drugs. Receptors are 7 types, 5-HT1 to 5-HT7. All are G protein coupled receptors. Exception is 5-HT3, which is an ion channel receptor. 5-HT1 drugs. 5-HT1 agonist. Location presynaptic serotonergic neurons. Subtype GI. Mechanism of action 5-HT1A IA is inhibiting release of 5-HT. Otherwise 5-HT would have gone and worked on 5-HT3, which after blocking it reduces anxiety. The drugs are buspirone, esapiron, gepirone, used as non-benzodiazepine anxiolytics. 5-HT1B, 1D and 5-HT1F. Location cranial nerve 5, trigeminal. Subtype GI. Mechanism of action cranial nerve 5 nuclei, its ganglion 5-HTG1. Lasmiditan is agonist. Here is an exon. You have the CGRP there. And triptans work on this receptor 5-HT1B, 1D. CGRP ligand is blocked. CGRP receptor blockers. Meningeal blood vessels have the CGRP receptor. Undergoes decrease in dilatation due to the blockage, decreased meningeal edema and compression, and decreased headache, migraine. Those are your triptans. Triptans approved for acute treatment of migraine. CGRP ligand blockers. Aptinizumab, fremanizumab, galcanezumab. Parenterally for prophylaxis of migraine. CGRP receptor blockers. Erinumab, atogepant, rimegepant. Per-oral for prophylaxis is erinumab and atogepant. And remigepant is per-oral for treatment of acute attack. Treatment of migraine, acute attack. Triptans, mechanism of action. Stimulates 5-HT1B, decrease CGRP release, vasoconstriction. Differ in pharmacokinetics more than pharmacodynamics. Rate of absorption is directly proportional to efficacy and potency. Drugs oral. Frovatriptan acts for 27 hours, more than naratriptan, which only acts for 6 hours. Slow oral absorption, long-acting plus slow-acting, used in prolonged attack. Rizatriptan, fast-acting, sumatriptan, zolmitriptan, elatriptan, elmotriptan, fast oral absorption, short and fast-acting, preferred in acute attack. Nasal spray, zolmitriptan and sumatriptan. Subcutaneous and rectal, sumatriptan overall fastest acting. Side effects, coronary vasoconstriction, acute chest pain, pain in jaw and neck, sweating, arrhythmia. Contraindication, ischemic heart disease, myocardial infarction, angina, stroke, TIA, ischemic bowel disease, hypertension, PVD, Raynaud's, Berger's disease. Specific contraindication, naratriptan cannot be used in liver and renal failure. Elatriptan cannot be used in liver failure. Zolmitriptan can cause Wolff-Parkinson-White syndrome. Sorry, cannot be used in WPW syndrome. 5-HT1F agonist is lasmiditan. CGRP receptor blocker is remigipant. Ergot alkaloids, ergotamine, mechanism of action. 5-HT1B1D, non-selective agonist, increased potent vasoconstrictor. Side effects: gangrene of organs with N arteries. Feet is most common. Dihydroergotamine, less potent, better tolerated. Side effect and contraindications same as triptans. D2 blockers, chlorpromazine, metoclopramide, NSAIDs, paracetamol for mild and moderate attack of migraines, ketorolac for severe attack. Opioids, intranasal butorphanol, oral codeine. In pregnancy, drug of choice is paracetamol, no response. Codeine, caffeine, metoclopramide, no response. Triptan, sumatriptan is the triptan of choice in pregnancy for migraine. Triptans may block placental blood flow. Prophylaxis: mnemonic. Flunarizine can prevent migraine. Flunarizine can prevent migraine. That is the mnemonic for prophylaxis. So the first drug is flunarizine, second is cycloheptadine, candesartan, clonidine from C. From P you have pizotifen and propranolol, which is drug of choice. From R you have release GABA, gabapentin, V valproate, N nortriptyline, topiramate, and M for methysergide. 5-HT2 drugs classification: receptor, antagonist and agonist. Antagonist: cycloheptadine, inhibits H1 and M receptors. Uses: migraine prophylaxis, serotonin syndrome, carcinoid syndrome, cold urticaria, AIDS, weight gain. Agonist: lorcaserin, used for treatment of obesity. Banned as risk of cancer is increased. Pizotifen, migraine prophylaxis. Methylsergide, migraine prophylaxis. Side effect is fibrosis in pulmonary, cardiac, and retroperitoneal. Flibanserin, 5-HT2 inhibitor plus 5-HT1 agonist. Treatment: hypoactive sexual desire disorder in females. Treatment of obesity: drugs causing anorexia, liraglutide, phentermine. Inhibitors of lipolysis, orlistat. Stimulator of lipolysis, mirabegron. Unknown mechanism: topiramate, naltrexone, bupropion. Note: 5-HT3 inhibitors, antiemetics. 5-HT4 agonists, prokinetics. Drugs banned for treatment. Banned drugs are rimonabant, reason increased suicidal tendency. Lorcaserin, causes cancer. Phenylpropanolamine, norepinephrine, banned drugs, causes stroke. Sibutramine is banned, causes myocardial infarction. We will continue with eicosanoids in next video.